Hello and welcome to the Patient Education series. My name is Christian, I'm an optometrist, and the aim of this series is to provide some information in plain English to those who want to know more about common eye conditions. Perhaps you've been told that you have cataract, glaucoma, or macular degeneration, and you're not quite sure what that means. Or perhaps you want to support a relative or friend. My hope is that after watching these short videos you'll have a clearer understanding of various eye conditions and I'll offer some helpful tips to support you. I welcome your suggestions for any topics you'd like me to cover in the future. And if you find this video helpful, please subscribe so that you're kept up to date as new videos are released. In this episode we're going to talk about using eye drops. Eye drops are prescribed or recommended for various reasons, and most of them fall into one of these categories. Dryness, allergy, you can have antihistamine eye drops just as easily as you can have antihistamine tablets. Infection, so antibiotic eye drops or antiviral eye drops for example. For inflammation, you can have the equivalent of ibuprofen eye drops or even steroid eye drops. And glaucoma, which is covered in a separate video, is commonly treated with eye drops to lower the pressure inside the eye. There are also some eye drops which are used by the optician when we're actually examining your eyes in the clinic, but we don't tend to prescribe those to patients. I'd like to cover some basic eye anatomy. Whenever we have tears in the eye or we put a drop in the eye, ultimately it drains through two little channels in the corner towards the nose. It drains through the nose to the back of the throat where they're swallowed. And you can see on this picture the little tiny white hole there is actually one of those drains. What we want with any eye drop is for it to be in contact with the surface of the eye for as long as possible so that it can be absorbed into the eye and have the maximum effect. So this is the process that we should follow when we're using eye drops. Step 1 is to wash your hands. You don't want to be introducing bugs into the eye. You want to make sure you have the correct drops and you know which eye that they're supposed to be going into. Do check the expiry date, and it's a good habit that when you open a new bottle for the first time that you make a note of the date when you actually open that, because a lot of bottles need to be discarded after 28 or 30 or 45 days from opening, so just check that on the instructions. After you put the drop in, we then want, as I said, to keep it in contact with the eye for as long as possible. We don't want it to drain through these little channels straight away. And to do that, we can use a technique called punctal occlusion, which is what this person's doing here. They do look like they're in some discomfort. It's not a great photo, to be honest. But you can actually do this for yourself. So if you feel in the corner of the eye, just near the nose, it's the same on both sides, you can actually feel there's a little lump in the corner there. And if you pinch on that, not especially hard, but just enough to essentially close it temporarily, then the drop that you've put in the eye can't go down the drain, so it stays in contact with the eye for longer and has a better effect. In an ideal world, you'd want to hold there for about 30 seconds after putting the drop in, but that's not always practical, so even 10 or 15 seconds is better than no punctal occlusion at all. I'll now run through 3 techniques to help to get drops into the eyes. The first technique, which is my preference, is to use a mirror. And the first step, really with any of these techniques, is to prepare the drop. And by that what I mean is that you squeeze the dropper bottle so that the drop is just hanging off the end there. If you squeeze it too much, it's going to drop, but if you don't squeeze it enough, then when you get in position, you're going to have to squeeze quite hard, and there's enough going on that that's just one extra step that you don't really have to deal with. So give it a little bit of pressure so that the drop's ready to go, and that's going to make the following steps easier for you. You then gently pull the lower eyelid down, as you can see in this picture, while the patient is looking in the mirror. And then you approach carefully towards the gap that you've created between the lower eyelid and the front of the eye, which is this sort of reddish pinkish pocket that you can see down here. What you don't want to do is to actually stick the nozzle of the dropper bottle into the eye, that way you could harm it. It's just the drop, and once you get close enough to it, a little squeeze so it drops in, or even if you gently touch the drop on the lower eyelid, it will actually automatically go in at that point. Let's have a look now at a video demonstration of this technique in action. So now we've seen the technique in action, I'll just give you a few additional tips to make this as easy as possible. The first thing is that you really want to make it as easy as possible to see what you're doing when you're looking in the mirror. So good light will help with that. Many people will benefit from a magnified mirror, whether that's a shaving mirror or a makeup mirror, or even makeup glasses. You might have seen these whereby this lens flips from one side to the other so that there's a gap here so you can actually access the eye with the eye drops. You want to make sure that you're a comfortable distance from the mirror. If you're too close to it, there's not going to be enough space for you to actually get the drop bottle in there. If you're too far away, you're probably not going to be able to see what you're doing. And you want your chin up very slightly. If you dip your chin right down, then the drop is more likely to go on the floor than it is in your eye. Whereas if you have your chin back, your chin up slightly, then through gravity, when you drop it, it's more likely to go into the eye. Next, as I've already mentioned, prepare the drop. And there's different ways of doing this, whether you're right-handed, left-handed, or maybe ambidextrous. Personally, I find it easier to use my right hand for my right eye, and I pull the eyelid down with my left hand, always approaching towards the edge this way. And I then tend to use my left hand for my left eye. Again, squeeze so the drop's ready, pull it down and approach this way. But if you're very right hand dominant, for example, you can cross over and pull the eyelid down, so you're still squeezing with the right, but it's a little bit more congested, a little bit more clumsy. So you need to find out what works for you, and as long as it's safe, it doesn't really matter. And when you are pulling your eyelid down, you're not holding down here on your cheek, you're getting reasonably close to the eyelid. You don't have to pull it right down, but you do want to just pull enough so that there's some safe space for you to get this in here. As I said, you don't want to touch the nozzle onto the eye itself. And when the drop's close enough, it will go in on its own if you don't squeeze that last little bit just to release it. The second technique doesn't require a mirror, but it does require you to have an idea of where your hands and specifically the dropper bottle are in relation to your eye. So for this one, you're actually either lying down or leaning right back. You're going to be relying more on gravity for this one. Once again, as before, you squeeze the bottle so that the drop is prepared, and you actually rest either your finger and the dropper bottle or the dropper bottle itself on your forehead, as you can see with the picture here, with the nozzle actually overhanging the eye. You want a gap between the nozzle and the eye of at least 1 centimetre, but probably more like 1 inch. Again, you just want to be careful that you're not coming in at a steep angle and actually sticking the nozzle into the eye itself. You're actually trying to lie almost parallel with the eye, and then as you look up towards your eyebrows, you'll probably be able to see the nozzle of the dropper bottle there, which means you're probably roughly in the right place. As you squeeze, the drop will either land in your eye, or it's going to land on your upper eyelid or your cheek or one side or your nose, and you'll then soon work out exactly where you have to have that nozzle so that it lands in your eye. But as you can imagine, if you're lying right back flat, then it's going to be much easier to get the drop in the centre of the eye than if I was sitting upright. There's no way that's going to go in, so it makes sense to lean back as far as you can for this one. Let's have a look at a video which demonstrates this. To recap on that technique then, so leaning back as far as you can or lying down if that's easier. Get the drop ready at the end, resting on the forehead so it's overhanging the eye, about a centimetre to 1 inch away, and you're going to get used to the correct position in terms of up, down, left and right so that those drops are hanging in the eye. But you want to be aware of the nozzle hanging there. It's probably going to be out of focus. But then you know that you're in roughly the correct position, and with a bit of adjustment then you'll soon get used to that. If you're not sure about the exact position, then you can get yourself some over-the-counter preservative-free teardrops for dry eye, and you can practice with those. It's not going to matter whether you get 4 or 5 of those into your eye in a practice session. And in terms of left-handed and right-handed, again, left hand for left eye is probably easier, but some people who may be very right-hand dominant, for example, can then cross over to the other side. But it's just really what's most comfortable for you. The third and final technique is to ask somebody else to help you with this. Now that's not ideal because that person may not always be available, and it's really important with eye drops that we use them as prescribed or as recommended. If we miss doses, then that can affect the health of our eyes ultimately. So please make every effort to try to be confident and competent at putting those drops in for yourself. Try the different techniques I've mentioned. This would really only be as a last resort. You can also ask your optometrist or ophthalmologist or their team to give you some support with getting drops in if you're still struggling. So the way this works, as you'll see, is I'm approaching this patient's eye from the side of their ear. I'm asking them to look up and in the opposite direction to the way I'm approaching. So because they're looking up here, they don't see the dropper bottle and the drop coming towards the eye, and that makes the whole process a bit easier and more comfortable for them. I'm pulling the eyelid down in the corner towards the ear rather than in the centre or towards the nose. And if I just show you a close-up of that, you'll see here that I've got the drop prepared, so it's hanging off there as I'm approaching the eye. I pull the eyelid down and then I drop the drop into this little pocket I've created just down here. Let's have a look at a video demonstration of that in action. The instructions this time are aimed more at the person that will be helping you to get those drops in. So this time it's the helper who needs to wash their hands and get the drop prepared. If you're putting the drop into, in this case it's the patient's left eye, then I stand on the patient's left side and I approach from the left corner. So it's always down there and the patient's looking up and in the opposite direction. So they're always looking in the direction of their nose, if that helps. Pulling the lid down, a drop in the little pocket you create, and then you let go of the eyelid. And then the punctal occlusion that we talked about earlier, you can actually occlude as the helper the patient's puncture, or they can do that themselves. So just worth being aware of that. And then when it comes to doing the other eye, I would then move on to the patient's opposite side, and I would again approach always from the outer corner here. For this eye, they're looking up in that direction, so they can't really see it coming. And for this eye, they're looking up in that direction, so they can't really see it coming. And that's probably the most manageable experience for the patient, especially if they're a bit squeamish. Despite all this, some people still really do struggle. I've seen patients with really advanced rheumatoid arthritis in their hands, and they just physically struggle to actually hold the bottle. Or they may not be strong enough to squeeze the bottle. Some bottles are actually a lot more rigid than others. And there are a whole range of what's called eye drop dispensing aids out there on the market. And this is a screenshot from Glaucoma UK's website. Glaucoma is one of those conditions where eye drops are a really common treatment, so they have quite a strong focus on these eye drop aids. But the drops that you're using don't have to be for glaucoma. You can still benefit from these various aids. So maybe have a look at that or some other equivalent websites. Because you may find some of these tools helpful. Finally, I'd just like to say a little bit about putting drops into children's eyes and babies' eyes. There's a good video from Moorfields Eye Hospital. You can find this on YouTube, how to put eye drops in children and babies. That's a good one to have a look at. What you can see in this case is the drop's been put in the corner of the eye while the eyelid is closed. And when the child then opens the eye, or you help them to open the eye, a good amount of that drop will then make its way into the eye. My experience in practice has been when they're about 3.5, 4 or more, you can get a drop in. You may need some support from a parent just to steady the head. So usually if the parent puts the hand on the child's head while they're sitting on the lap, and they just hold the arms down. But what you don't want to do, you see, is to again put the nozzle in the child's eye. So if you go back to the technique I showed for using a helper to put drops in, that approach will work quite well with children. Sometimes it's easier to lie them down, but the main thing is you don't want to injure the eye, but nevertheless you still need to get the drop in there. The video I think will help you, What you can do also, if it's for the first time, many drops are safe just to put one drop on the tip of the finger so the child can see it doesn't hurt. Just make sure you wash that off afterwards, because you don't want them putting it in their mouth. Thank you for watching this video on using eye drops. I hope you found it helpful.